Welcome to our educational video on intracellular accumulations and pigments. Intracellular accumulations refer to the abnormal buildup of substances within cells, which can occur due to various reasons including metabolic disturbances, genetic defects, or exposure to harmful substances. These accumulations can be harmful, altering cellular function and potentially leading to cell injury or disease. The mechanisms of these accumulations are abnormal metabolism leading to accumulation of substances like fats or proteins seen in fatty liver, mutations affecting protein folding or transport seen in protein accumulation in kidney cells, enzyme deficiency leading to accumulation in lysosomal storage diseases, and indigestible materials like carbon particles that cannot be degraded. The pathological states due to intracellular accumulations are discussed now. Adaptation change is characterized by the accumulation of triglycerides within parenchymal cells, most commonly in the liver. It can also occur in other organs like the heart, skeletal muscle, and kidneys. Its causes include toxins, protein malnutrition, diabetes mellitus, obesity, and anoxia. Alcohol abuse and diabetes are the most common causes of fatty liver. Protein accumulations, though less common than lipid accumulations. It can occur in cells due to excess proteins or excessive synthesis of proteins can cause these accumulations. Examples include protein droplets in kidney tubules and Russell bodies in plasma cells, which are reversible if the underlying conditions improve. In the kidney, trace albumin is normally reabsorbed, but in nephrotic syndrome, much more protein is reabsorbed, forming pink, hyaline cytoplasmic droplets. Another example is the accumulation of newly synthesized immunoglobulins in the rear of plasma cells, forming rounded, eosinophilic Russell bodies. Glycogen accumulation. Excessive intracellular glycogen deposits are linked to glucose or glycogen metabolism abnormalities. Glycogen accumulation occurs in cells due to genetic disorders called glycogen storage diseases or glycogenosis. Pigments. These are colored substances that can be exogenous or endogenous. Exogenous pigments are pigments introduced into the body from outside sources, such as inhalation, ingestion, and injection. Inhaled pigments such as carbon or coal dust, silica or stone dust, asbestos, and organic substances are commonly found in the lungs of most individuals, especially smokers and those living in polluted urban areas. These substances can cause occupational lung diseases called pneumoconiosis. These pigment particles after inhalation are taken up by alveolar macrophages. Some are coughed out while others settle in the lung tissue and pass into lymphatics to be deposited in the hill or lymph nodes. But extensive deposition over years can cause inflammation and impaired respiratory function. Chronic ingestion of certain metals may produce pigmentation, which is seen in argyria, chronic lead poisoning, and carotenemia. Injected pigments or tattooing involves injecting pigments into the dermis where macrophages absorb them, permanently embedding them in connective tissue. Examples are India ink, cinnabar, and carbon. Endogenous pigments are either normal components of cells or accumulate under specific conditions. Examples are lipofuscin, melanin, and hemosiderin. Lipofuscin is an insoluble brownish yellow granular intracellular material. It is formed by the free radical catalyzed peroxidation of polyunsaturated lipids of subcellular membranes. It accumulates in various tissues, particularly the heart, liver, and brain, with aging or atrophy. The brown pigment, when present in large amounts, imparts an appearance to the tissue that is called brown atrophy. Melanin acts as a screen against harmful UV radiation. It is brown-black pigment synthesized by melanocytes located in the epidermis. It accumulates in adjacent basal keratinocytes and dermal macrophages. The last is hemosiderin, which is a golden yellow to brown granular pigment derived from hemoglobin accumulating in tissues due to excess iron. Normally, iron is stored within cells in association with the protein apoferritin, forming ferritin micelles. Hemosiderin is formed by aggregation of ferritin micelles, which are iron-protein complexes. Hemosiderin accumulation is usually pathological, but small amounts are normal in certain organs where aging red cells are degraded. Excessive deposition of hemosiderin is called hemosiderosis. If you found this video helpful, please like, share, and subscribe.